From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. We've all heard of injectables like Botox and fillers, but there's a new wave of treatments in aesthetics, regenerative injectables. These treatments do more than just enhance your appearance. They actually restore and rejuvenate the skin from within. Our guest today, Samantha Pino, a family nurse practitioner, is at the forefront of this shift. She's the founder of Face by SP, a practice rooted in blending anatomy and aesthetics for results that are natural, long-lasting, and truly rejuvenating. Her mission is to help clients understand the aging process from a holistic perspective, leading to organic beauty and personalized results. Today, she's here to break down regenerative injectables, what they are, how they work, and why they're quickly becoming a go-to aesthetic treatment. Hi, everyone, and welcome to the Care Experts podcast. I'm so thrilled to have Samantha Pino joining me today. Welcome to the show.
Thank you. I'm so excited.
Before we dive into regenerative injectables, can you tell me a little bit about your background and how you got to where you are right now?
Yes, absolutely. So I am a nurse by trade. I was a nurse for almost 6 years. I did a little bit of everything. I worked in California, actually, as a travel nurse for a little bit. New York, Miami, I did emergency room during COVID. I did a little bit of intensive care, both for cardiac and surgical. And I loved my time as a nurse. And then it was time for the next step, which was to get a master's degree as a nurse practitioner, where I had a little more autonomy as to what I could do next. And then it came to what am I going to specialize in? I was actually gung-ho on pediatrics. I love kids, and it's kind of what I thought I would see myself in until I ran into a post one day on Instagram by the London Academy of Aesthetic Medicine, which is a training academy in London. And it was Dr. Wasim Taktok and Dr. Tara Francis kind of going into the anatomy of an aging face and all of the things that we can do regeneratively to help with it. Catapulted me into a rabbit hole of everything aesthetics at that point. And it was just a new field and a new introduction for me that I fell in love with quickly. And from then on out, I went to London. I trained with them. I came back to Miami, and shortly after I opened up my clinic in Doral. It's Face by SP. We have an amazing team. We offer a lot of regenerative options. And now a few years later, we brought the London Academy Training Academy to Miami. And we train providers to get excited about the field and get really good at the anatomy of the aging face.
Wow. It is such an interesting topic, and I feel like there's just so much change in this area of skin health, even in a very short period of time. So I'm thrilled to have you here so that you can help share your expertise and wisdom with us. I know we all have a lot of questions. I thought that we would start this episode off with a little true or false series. You ready?
Yeah, I'm ready.
Okay, the first one, true or false? Drinking water actually helps prevent wrinkles.
True.
Okay.
I think drinking water helps with everything.
Yes.
But essentially for the skin, it's going to pull water into those skin cells and make them a little plumpier, which essentially makes our skin look better. There's obviously other things causing wrinkles, so it's not going to fix all of our aging issues, but it definitely helps quite a bit. And it also flushes out the toxins of the skin, which is nice.
Amazing. All right, everybody go get yourself some water right now and start sipping your water while we're having this conversation.
Yes.
Step one.
Step one.
True or false? You can use PRP to help grow back both your hair and your nails.
True. PRP is one of those things that's useful for regeneration pretty much anywhere. They even use it in the joints to regenerate tissue from arthritis and things of that sort. But yes, we use it a lot in hair. I think there's a specialty that injects it into toenails and fingernails as well to help them regenerate, especially people who've lost it from like severe fungal infections and things of that sort. So true.
It sounds amazing. True or false? Botox is the best way to reduce the look of aging and wrinkles.
Can I say true and false?
Yes, you can.
Okay.
But you have to explain why.
I'll explain. So true, because it's really the only modality or tool that we have to stop wrinkles that are caused by muscle contraction. Okay. There's really nothing else on the market that can do that except for neurotoxins like Botox. False, because it's not the best way. We need a little bit of everything to get there. So it's one of the ways, yes.
Okay, we're going to talk about some of the other ways in this episode today. True or false? A facial massage can really boost collagen production.
True. Yeah.
Really?
True, yes. To a certain extent. Obviously, it's never going to match what these minimally invasive or invasive procedures do, but it's a good at-home way for like clients to get involved in their anti-aging process. So anytime we're causing kind of that increased blood flow to the skin, we're going to get that rush of nice, healthy cells to the area. And it also like triggers the fibroblasts, which is our cells that make collagen. So I think that like red light therapy, things of that sort are great for clients to do at home.
Okay, so step 2 is sip your water and give yourself a little face massage while you're listening.
All the things.
We're starting right now. We're starting today. Okay, next one. True or false? You should start getting regenerative injectables once you hit 40.
False.
Oh.
Yeah, false. I think before that, when we think it's not too late at 40, absolutely. I think any age is the right age for regenerative injectables, but if we could start earlier, we should. Back to what I always say, proactive aging treatments, not reactive aging treatments. We start losing collagen since we're 20 years old. By the time we're 30, 10%'s gone. So probably mid to late 20s, early 30s. Patient specific, but you can start even with the gentle stuff.
Okay. And the last one, true or false, injectables can give you a facelift without the need for surgery.
False. I don't think anything can give you a facelift, because when we think of what a facelift is, so that everyone knows, we're pulling the muscle up, like physically cutting, lifting muscle.
Yes.
And there's not really much of what, non-invasive we can do to get that. But it can prolong or prevent needing a facelift. Yes, absolutely.
Okay, amazing. All right, let's dive into a conversation about regenerative injectables. Okay. Can you just start off by telling us what these even are? What are regenerative injectables?
Yeah, so this excites me because this is what got me into the industry. Regenerative injectables it's not just injectables, it's also like lasers and treatments, regenerative treatments altogether are things that are going to stimulate our own natural healing process to produce collagen, to produce better, thicker skin and remodel, old damaged tissue into new tissue. So that's essentially what they are. And it's something that the industry has transitioned over, as you mentioned earlier, in the recent 5 to 10 years. And it's a huge boom. And I feel like it's the comeback of our field.
I really feel like this is what everybody is talking about right now. And that there's been a shift away from Botox and fillers, or freezing and fillers, to these more regenerative procedures. Why do you think this is?
I think the shift comes from multiple things. One, I think people being knowledgeable. So I do credit social media for that, because we have so much access to all this knowledge that maybe we didn't have before. So I think it comes from clients being knowledgeable on how to get a more natural, realistic approach to aesthetic treatments. But I think it also comes from like the professionals within the field, right? So all these companies that produce and manufacture the products we use, the research that they conduct and that they've been conducting, and all of these new modalities that have come to light, and just not new modalities, but new ways to use what we already used, like Botox and filler. And then it's also credit to the injectors and the professionals within the field for exploring and learning and always evolving, not staying stuck in the old ways. I don't want anyone to be scared of Botox and fillers, because I feel like that's also a trend that's happening.
Yes.
And I think we need them, and they're important. They just need to be used properly, and we need to make sure that we're using regenerative treatments in conjunction.
Okay. Now, I'm hearing a lot about prejuvenation versus just rejuvenation. What's the difference, and why are people leaning into more prejuvenation?
So prejuvenation is just a term to like get ahead of what we know is going to happen, right? So we age everywhere. We age in all the layers of our skin, our bone, our fat pads, our muscle, our dermis, everywhere, right? So we know what's going to happen. Why not do treatments that we know are going to get ahead of what's going to happen? And that's what prejuvenation is. And then we throw in rejuvenation in there as like the accessories of the house, right? So wherever we need a little bit of an oomph, that's when we can use them.
Yeah. Are there any benefits to these regenerative injectables beyond just the aesthetics? Like, is it actually caring for our skin health in a way, or can it prevent skin cancers or anything like that?
Absolutely. I don't think there's much research on what it can do for things like cancer, but I do know it's beneficial in much more than just the aesthetic benefit that we see from the outside. We know we lose bone as we get older, and that's why exercise and replacing our calcium and our vitamin D is so important. But these are other ways to replace what we're losing as we age. And collagen is important more than just for aesthetic purposes, right? It helps us internally in so many ways. Obviously, when we're thinking of injectables, we're really just targeting the face for the most part, but there's so many more benefits than just that.
Amazing. And when we talk about regenerative injectables, there are 3 main types generally that people are referring to. Can you walk us through those 3 types and tell us a little bit about them?
Yeah. I think one of the common ones is PRP or PRF, which is plasma, and I'm a huge fan of it. I do it a lot in my clinic. Basically what it is, it's platelet-rich plasma. So we extract the plasma portion of our blood. We draw your blood, we centrifuge it, and that's how we can separate it. And what this plasma does when it's injected somewhere is it helps produce collagen and kind of new cell growth within the area. And you can pretty much use it anywhere. You can use it for the hair, you can use it in the skin, you can use it deeper down. Like I mentioned, you can use it in the joints. So it's a beautiful option with not a lot of downtime. We also have our biostimulators, which all of these technically are biostimulators, but Sculptra and Radius are kind of the 2 big players in the game. What they are, they're another form of injectables. One of them is a PLLA, which is Sculptra, and one of them is a calcium hydroxyapatite, which is Radius. And these are another injectable that does pretty much the same thing in terms of it's going to stimulate collagen in that area or create like a scaffold for collagen to grow around. So they're beautiful. And also do them a lot in clinic, love them. And then we have polynucleotides, and that's all the rave now. But polynucleotides are great. They're a little different in the sense that they actually come from fish DNA, typically salmon.
Oh, interesting.
So our DNA, even in humans, it's made up of like these little fragments called polynucleotides, right? Essentially what these scientists are doing is they're grabbing the DNA from fish and they're breaking it down into its little fragments, which are polynucleotides. They're refining it, they're purifying it, and they're making it into an injectable form. They're strong antioxidants, so they're going to protect us from all the free radicals, but they also absorb water. That's why they make us look plumper and brighter. And they talk to the little receptors in our fibroblasts, and they like produce more collagen, basically.
Okay, so your body's actually producing more collagen. It's really encouraging your body to work along with the substance that's being injected versus just having the substance like a filler would be
sitting there
under the skin. Okay,
Yeah.
Wow, so interesting. Polynucleotides are, again, I feel like everyone's discussing them right now. I love hearing the science behind them. How are they actually used? Is it injected, topical?
So both. You can use it in multiple ways, similar to plasma, right? We can use it topically, we can use it injected. Typically when you're using these things topically, they need some sort of transport system to get into our skin. So microneedling, anything that's kind of going to open those chambers up for us so that they can absorb. They also, when you're doing them post resurfacing treatments like CO2 lasers, microneedling, they're going to help speed up that healing process, which is really, really nice. Less downtime. But then we have the injectable forms, which are getting a little bit deeper down and having a little bit more of that collagen production side of things. We can inject them in the under eyes. We can inject them superficially or deep, anywhere we see a fold, a crevice, for hair growth, almost anywhere.
Wow. And how would you know whether or not you need the PRP, a biostimulator, or the polynucleotides?
We need them all.
Oh, okay. Simple answer is
we need them
there's
all.
Different purposes for them then.
There's different purposes. Sometimes we do combinations. Like a lot of times clients will come in, I'll do like 2 sessions of plasma and then we'll switch over to 2 sessions of polynucleotides.
Okay.
It's different modalities. The more we combine, the better our result and the longer lasting our result, which is the key here, right? We want to make it last.
And what are the results from a polynucleotide treatment?
So the results typically you're going to see more hydration and plumpiness to the skin.
Okay.
We love it for brightening. So the under eye especially, which is very common complaint that people have. And typically it's genetic discoloration and it's hard to target. We get some of that brightening effect from it. But also anywhere we have some superficial creasing or wrinkles, if we target it directly there, we see a nice little elevation of that area.
Once it's injected under the skin, does it stay there? Is it absorbed by the body? What happens after?
It gets absorbed. What remains is that fibroblastic collagen production activity that comes afterwards.
That's
right?
naturally occurring in the body anyways.
And that's all about what biostimulators are. That's why I feel like they all kind of fall within that realm. They're all triggering the body to create a healing process and to create collagen. And that's essentially the end game.
Amazing. Any side effects or people who would not be a good candidate for this?
If you're allergic to fish, because it does come from fish, you cannot have polynucleotides, but you could have plasma and you can have Sculptra, Radius, things of that sort. So there's options. Downsides to almost all of these are going to be a little swelling, potentially a little bruising, especially in the under eye area. We have a lot of little vasculature there. But other than that, it's a very low downtime, low maintenance.
Is downtime like a few days or?
Okay. A few days, at most to a week, but it's not downtime that you can't go about your day-to-day life. It's easily covered.
What can you expect with that downtime? Is it redness?
It's not so drastic. So you'll have a little bit of swelling in the area. Some people more than others. That just depends on your natural inflammatory process. But you could expect some bruising, especially if we're using like needle technique versus a cannula. So I would say bruising, a little bit of swelling, and maybe a little bit of soreness in the area, but very mild.
And how often would you be doing these types of treatments, and specifically the polynucleotides?
Yeah.
Is it a couple times a year, every couple of months?
So sometimes we'll do it in like a series. And with biostimulators, that's like a very common theme. Maybe every 4 to 6 weeks, we'll reassess, potentially do another session, anywhere from 3 to 4 sessions, sometimes less, just depends on the patient. And then the results can linger over a year, right? So this is something that you do have to maintain because our body naturally is going to still age. But it's not something that needs to be so frequent after you kind of get to the point where we're happy with it.
We have some questions from our audience for our Ask Me Anything segment. Is it true I can't be outside in the sun or exercise for a week after I get regenerative injectables?
Yeah. Typically, that's kind of the gold standard. And as far as the sun, I typically tell my clients 2 weeks just to be safe. In terms of exercise, a little less, maybe like 24, 48 hours, let everything settle, and then you can go get your workout in.
Amazing. I have sensitive skin and react to a lot of treatments. Would polynucleotides be a good option for me?
That would depend. So that would require a consultation, see what sensitivities you have, what have those reactions actually been. You may have a little more of a healing process and downtime from it, but doesn't mean you can't get them. It just depends.
How soon after getting regenerative injectables can I do my normal skincare routine?
So you can go by your normal routine in terms of cleansing, hydrating, sunblock. But when it comes to acids, strong exfoliants, retinols, things of that sort, I typically say hold off for about a week just to let the skin heal and not cause any more irritation to it.
Amazing. If I'm doing regenerative injectables, can I still get a facelift?
That is a great question. Yes, the answer is yes. Typically, when you're getting a facelift, they're manipulating the SMAS layer, which is our muscle layer, and pulling the muscle. And if we're injecting these biostimulators, they should not be injected into the muscle, right? Could it make the work of a surgeon a little bit more difficult because we have some of that scar tissue development? Yes, but most surgeons will not mind it.
Thank you so much for joining us on Care Experts. It's been such a pleasure having you here.
I've loved being here.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.